medical knowledge. Today video is about the frozen shoulder. I have broken down the contents of my video. First of all, I will give you a basic explanation of what a frozen shoulder is. Then I will tell you about the various causes, the causes related to shoulder and the causes not related to shoulder which can lead to the development of the frozen shoulder. Then I will tell you about the different phases of the frozen shoulder and what are the signs and symptoms with which the patient presents during all those phases. Then I will tell you about the various treatment options available during all the different phases of the frozen shoulder. Okay, so now let's first of all start with the basic explanation of the frozen. Starting with the basic explanation of the frozen shoulder. The frozen shoulder is also termed as adhesive capsulitis. So the second name for frozen shoulder is adhesive capsulitis. From this term, we get to know two things. First one is the adhesion or the adhesive formation, or the second one is the capsulitis, which means the inflammation of capsule. So the primary thing which occurs in the frozen shoulder is that there is the formation of adhesions in the capsule of the shoulder joint. So from adhesive, we can say that there is the formation of adhesions. Plus there is the inflammation of capsule along with the thickening. So these are the two things which we come across in the frozen shoulder. There is the formation of adhesions, and then there is the inflammation and the thickening of capsule, which leads to the development of the frozen shoulder. Okay, when we see a case of, it is important to note that every shoulder pain does not means that the patient is suffering from the frozen shoulder. In the frozen shoulder, primarily the capsule of the shoulder joint is involved, and if the patient presents with the movement restriction in the capsular pattern, then we can interfere from that fact that might be the capsule is involved in some way or the other, and the patient might be suffering from the problem of frozen shoulder. So I will also write down the capsular pattern of the shoulder joint, which is the lateral rotation. Then there is the abduction, and then there is the medial rotation. So if the patient comes with this capsular pattern, we can think that the capsule is involved, and the patient movement will be restriction in this order. The lateral rotation will be most painful and it will be most restricted, followed by the abduction and the medial rotation. So we cannot diagnose every shoulder pain as the cause that it might be frozen shoulder. We have to look for other signs and symptoms. The patient will usually present with intense pain and stiffness if it's the initial stage, and his or her capsular pattern will be most restricted. Okay, so these are the things which we can think of in diagnosing patient with the. About the different causes of the frozen shoulder. The causes of frozen shoulder can be categorized into two categories. The first one are the causes directly related to the shoulder, and the other are non-related to shoulder. Talking about the first category, which is related to the shoulder, are the trauma, tendinitis, and the overuse and the faulty posture. Any trauma around the shoulder joint can lead to the decreased activity, and which can further lead to the development of the frozen shoulder. Then the tendinitis of the muscles around the shoulder joint, or due to the injury of the rotator cuff muscles, there is the decreased use of arm, which can further lead to the development of the frozen shoulder. Then talking about the overuse during excessive activities can place extreme stress on the or strain on the capsule around the shoulder joint, which can lead to pain and which can further lead to the development of frozen shoulder. Now they're talking about the faulty posture or the poor posture during sleep. Mostly patients sleep in a way that their head is placed on their arm and their shoulder is locked in the external rotated position. So this can lead to pain, and which can further lead to the development of the frozen shoulder. Talking about the causes not related to shoulder, these causes are the diabetes, rapid pain, and the muscular weakness. Diabetes, it is a pathological condition which affects mostly all of the systems of the body and can also lead to development of the frozen shoulder. We're talking about the rapid pain. Any pain due to rapid pain means that the original source of pain is something somewhere else in the body, but its pain is presented at the site of shoulder. So this can also lead to development of the frozen shoulder. And then there is a muscular weakness, weak musculature, or inability of muscles to perform the required functional activities. There is the decreased use of arm, which can further lead to the development of the frozen shoulder. Now I will tell you about the different phases of the frozen. We were now talking about the different stages of the frozen shoulder. There are the four main stages of the frozen shoulder. Talking about the stage 1, during the stage 1, there is intense pain around the shoulder joint. There is stiffness around the musculature of the shoulder joint, and this stage lasts for less than 3 months. So I will write down. So during stage 1, the patient feels intense pain, the stiffness, and the pain is usually experienced during the night. So the night pain is also a sign. The stage 1 lasts for less than 3 months. About the second stage of the frozen shoulder, the second stage of frozen shoulder is also termed as the freezing stage. During this stage, there is more intense pain. There is pain at rest, and this stage lasts for about 3 to 9 months. So I will write down, this stage is known as the freezing stage. There is more intense pain and pain at rest, resting pain, and this stage lasts for about 3 to 9 months. Okay. Now talking about the stage number 3, the stage 3 is also known as the frozen stage. During this stage, there is a development of adhesions, and there is more restriction of motion around the shoulder joint. So during this stage is known as the frozen stage, and during this stage there is the formation of adhesions, and there is limited arm. Okay, there is extreme formation of adhesions and there is limited arm, and this stage lasts for about 9 to 15 months. Okay, we're now talking about the stage number 4. The stage number 4 is also known as the thawing stage. During this stage, there is pain experienced only with activity. There is no synovitis, and this stage lasts for about 14 to 24 months. So this is known as the thawing stage. And during this stage, there is pain only with activity. This lasts for 15 to 24 months. Okay, these are the 4 different stages of the frozen shoulder. Is the stage number 1, during which there is intense pain and stiffness and night pain, and this duration lasts for less than 3 months. Then there is the stage number 2, which is also known as the freezing stage. There is rest pain, and there is increased onset of pain, and this stage lasts for 3 to 9 months. The stage number 3 is known as the frozen stage. During this stage, there is formation of adhesions and there is capsular restriction, and RM is also limited, and this stage lasts for about 9 to 15 months. And then there is the stage number 4, which is also known as the thawing stage. During this stage, there is pain only with activity or pain at the end of our arm, and this stage lasts for about 15 to 24 months. Now I will tell you about the different treatment options during these phases. Everyone are talking about the treatment of the frozen shoulder. The treatment of the frozen shoulder varies according to the stage of frozen shoulder. First of all, talking about the maximum protection phase, which lasts for about 3 months. During this stage, the main presentation of the patient is the pain and inflammation. So for the control of pain, we can prescribe him NSAIDs. Talking about the physical therapy interventions, we can perform the passive range of motion, gentle grade 1 and 2 mobilization, and we can teach him the pendulum exercises. These exercises are very helpful during the first stage and they can prevent the formation of adhesions. Now talking about the controlled motion phase, which is the next phase. During this phase, we can perform a grade of 3 and 4 oscillations. We can perform mobilization with movement. So these are the things which we can do. There is a mobilization with movement, and there is the grade 3 plus grade 4 oscillations. So during the controlled motion phase, these are the techniques which we can perform. The first one is the mobilization with movement, and then there are the grade 3 and 4 oscillations, and we can also teach the patient for different exercises for self-mobilization, which the patient can himself perform without the assistance of anybody else. So these are the interventions which we can give the patient during the controlled motion phase. Now talking about the return to function phase, this is the last stage of the frozen shoulder, and the patient is recovering from the disease. During this stage, our main focus is to strengthen the musculature around the shoulder joint and to stretch to prevent any further adhesions. So the two main interventions which we can perform during this phase are the stretching exercises and the strengthening exercises. So these are the two exercises which are helpful during the last stage of the frozen shoulder. So these were all the treatment options available during the different phases of the frozen shoulder. Okay everyone, I hope you got a better understanding of the condition of the frozen shoulder. If you have any query, you can ask me in the comment section. If you like my video, give it a thumbs up and kindly subscribe to Medical Knowledge. Thank you for watching my video.